Ministry of Health has seen increased cases of long COVID. Minister Dr. Frank Anthony, during Wednesday's COVID-19 update, said persons who have recovered from the coronavirus have been reporting other medical issues. These include heart issues, brain, lungs, and blood, among other health complications. He explained that because of the way the virus is designed, it affects almost every organ in the body.
Different persons would have different manifestations of the disease depending on which organ for that person was most infected or affected. Some people, if the virus would have predominantly affected their brain, they continue even after being discharged from the hospital to have hallucinations. Sometimes they have what is called brain fog, meaning that in the midst of a conversation they kind of zoom out. They're not understanding what is going on around them.
The minister explained that some patients also experience heart problems with symptoms that mimic myocardial infarction or heart attack. This is especially observed in patients that are younger.
Some persons, 30 years old, having typical signs and symptoms of heart disease, so they get pain in their chest and so forth. So that's something we have to monitor as well. We have seen persons who prior to COVID were not diabetics, and after COVID they would have presented with symptoms of diabetes. And again, we are seeing people not just with diabetes, but we are seeing people who would have other types of diseases relating to the endocrine system.
He said blood diseases have also been observed in patients who had recovered from COVID-19.
Quite a number of the patients would have damage to their lung, and therefore they'll require physiotherapy to be able to help them to breathe properly. And some of them, the damage can be very challenging to repair, and sometimes it's not reversible. So for a few of those patients, they had to stay on oxygen, and it prevents them from working and a whole host of other things.
The minister noted that the health system now monitors these patients and get thorough history from the patients to know at what point they had COVID and how to treat them. He also noted that persons should therefore guard against getting infected by being vaccinated and taking the public health precautions.